Vision Center on Greenville Boulevard. I've been an optometrist for about 7 years, and I was an optometric tech for 6 years, and I was an ophthalmic tech for 2 years. I love to work with the entire gamut of patients that we have, whether that's our elderly or our pediatric patients. It's nice to have a little bit of variety, but I think the biggest thing I really enjoy is being able to give patients that instant gratification as far as how they can see again. Sometimes they come in and they feel like their vision is really poor and they're not sure if they're going to be able to see well again. And sometimes it's as simple as changing their glasses prescription or being able to determine whether or not a patient has dry eyes or something like that that may be causing some ocular issues. So making the patient feel better is our ultimate goal. Annual eye exams are important for anybody. It doesn't matter if you're a child or you're 20 years old or you're 60 or you're 80. Annual eye exams help us to determine if there's something underlying going on inside the eye that you may not have symptoms for. Oftentimes, people with diabetes or high blood pressure or even elevated cholesterol may not realize that there's an issue there. And sometimes I think we're all guilty of saying, oh, it'll go away. But oftentimes it doesn't go away. And to ignore it and wait until it becomes a real problem, at that point it becomes more difficult to address. So annual eye exams help us to determine anything that may be underlying that you may not have symptoms for, therefore addressing it earlier and having a better outcome. I like to think that our office is a very progressive office. We have a number of different types of instrumentation that allow us to really assess the ocular health of a person's eye. And that can be the OptiMap, as I mentioned previously. The OptiMap really takes this wide retinal view that allows us to look at the retina in a way that sometimes is difficult when we look inside the eye. And it allows us not only to see it, but to document it so that in the future we can better monitor progression or improvement. Some of the other technology we have is the OCT. And the OCT is allowing us to look at the underlying layers of the retina. When we look inside the eye, or if we take a digital image, basically we're looking at the outside of the retina. And so this looks at those underlying layers so that we can determine if there's anything going on there. Think of it almost like an MRI. And then we also have our digital retinal imaging that is very similar to the OptiMap, except it takes a smaller area and therefore allows us to look at it a little bit more detail. We also have the VEP, which allows us to test the functionality of the optic nerve, which is responsible for sending messages from your eye to your brain. So we want to make sure that little pathway is working properly, especially for our patients with glaucoma or any type of optic nerve disease. In closing, I just wanted to make sure that everybody in our office, as well as everybody in the community, knows that Dr. Watson, Dr. Jason Harris, as well as myself and our staff are here to address any needs that you have, whether that be during office hours or after office hours. We are very happy to help out in community service projects such as vision screenings, health fairs, and that type of thing. So you'll probably see us out and about there as well. We look forward to seeing you next year.